Hello and welcome to Borno Restoration. I am Jessie Tafida. In a state once defined by conflict and broken systems, the story is gradually changing. Today on Borno Restoration, we focus on how Governor Babagana's Zulum administration is rebuilding one of the most critical pillars of society, healthcare, through the Borno State Contributory Healthcare Management Agency, BOSHMA. From expanding access for vulnerable families to digitization, enrollment, and restoring confidence in public health institutions, BOSHMA has become a cornerstone of the state recovery blueprint. But first, let's bring you developments across Borno. At the eye and dental hospitals in Maiduguri, hope is gradually finding clinical expression. The managing director of the Northeast Development Commission, Muhammad Al-Khali, made this known during an assessment visit to the facilities, stressing that improving healthcare delivery remains a top priority for the commission.
People should train on how they are going to be used. This is why we engage those who have the knowledge to come here to unbundle the equipment and make it functional. So today I can see what these machines are doing and to see people appreciate what they are.
About 8 months ago, the NEDC procured and deployed over 3 billion naira worth of state-of-the-art eye and dental care equipment, technology designed not just to treat patients, but to restore confidence in a system battered by years of conflict. According to the Commission, the intervention is aimed at bridging the healthcare gap created by more than a decade of insurgency, which crippled infrastructure and drained specialist services across the region.
It's kind of a seminar to discuss with all the medical directors of nurses to find out what is their own critical need equipment, and they all provided what they needed to make them work as it should be.
Beyond procurement, the NEDC says it is also investing in human capacity, with doctors, nurses and technicians currently undergoing training to ensure optimal use and long-term sustainability of the equipment. With these upgrades, the hospitals are now expected to function at full capacity, serving not just Maiduguri, but communities across the northeast and even neighboring regions. From survival to stability, the Northeast Development Commission says its healthcare interventions are part of broader promise to ensure that the wounds of conflict do not define the future of the Northeast. The Borno State Police Command says it will continue its operations across the state to ensure that criminal activities are further reduced and relative peace is sustained. The police public relations officer, Nahum Dasu, stated this in an interview with TVC News, noting that the calm currently being enjoyed by residents did not happen by chance. According to him, it is the outcome of constant patrol and strategic visibility by police officers across major roads, neighborhoods, and flashpoints in the state.
For the year 2026, we have already set the tone and a good pace by entering 2026 on our right foot and not giving the criminal element gap for them to continue with their criminal activities. The first one of the major successes that we've recorded is the arrest of 65 suspects. We were in possession of dangerous weapons, cutlasses, knives, large catch of drugs, and a whole lot of exhibits were recovered for this suspect. We have had many years of many incidences that happen over time, but we want to see that we don't allow those things to happen again. That's why we are calling on them to support us with timely information, report incidences, and don't keep it to your own self.
ASP Dasso assured residents that the command is rolling out additional security measures to curb pockets of crime, especially as activities increase across the state. He insists the police remain proactive, alert, and ready to respond swiftly to any threat to public safety.
There is constant patrol of police personnel. There is visibility and deployment of police personnel at strategic location. And we are now working, members of the public have shown us that they want to even work with us by supporting us with timely information. So any criminal elements, we want to warn them that they should know that there will be no room for them, because we'll keep on to nip in the bud any of their criminal intentions, activities in which they may want to carry out in Borno State.
As the police tighten their grip, the message is clear. Borno's peace is being guarded, and with public cooperation, the state can continue its steady march away from fear and towards lasting stability. In the latest phase of their operations, soldiers successfully cleared and dominated key terrorist enclaves, including Terjejeri, Tilaria, and the Ajigin Abirma general areas. During the advance, troops made intermediate contact with fleeing insurgents and engaged them decisively, killing several terrorists in the process. The operation took a dramatic turn while troops were consolidating at a harbor area about 6 kilometers north of Shilaria. Soldiers encountered two vehicle-borne improvised explosive devices, VBIEDs. Through alertness and swift response, one of the devices was successfully destroyed. The second VBIED, however, breached the defensive position, affecting some logistics platforms. During the incident, some soldiers and members of the Civilian Joint Task Force lost their lives, while others sustained injuries. The wounded were promptly evacuated by Nigerian Army aviation helicopters to the 7th Division Medical Service and hospital, with Nigerian Air Force platforms providing aerial cover. Troops later uncovered mass graves containing about 20 terrorist bodies, further indicating heavy losses suffered by insurgents in the area.
And even now, as we speak,
the military says operations are ongoing, with troops maintaining pressure on fleeing terrorists as efforts continue to restore peace and security across the northeast. The Borno State Contributory Healthcare Management Agency, BOSHMA, continues to widen the safety net of affordable healthcare for residents across urban and rural communities. With reforms anchored on efficiency and inclusion, the agency enhanced digital enrollment platforms has transformed the registration process. What once required long queues and paperwork is now streamlined, transparent, and significantly faster. The result is a system that is gradually restoring trust and bridging structured healthcare financing to the forefront of Borno's rebuilding efforts. Let's take this report. Once the heartbeat of communities across Borno State was silenced by years of conflict. Clinics fell quiet, hospital wards emptied, and hope itself appeared to be gasping for breath. For over a decade, violence tore through the foundations of the state's healthcare sector, destroying close to 60% of healthcare facilities and cutting off more than 1 million residents from access to basic medical care. No one left to answer. Once detected access to healthcare Boschma introduced structure. Where distance once denied treatment, the agency brought services closer. Through the contributory healthcare scheme, vulnerable populations, internally displaced persons, low-income earners, and rural dwellers are now being woven back into the residents have now been enrolled. Each registration a quiet victory against years of exclusion. Healthcare, it seems, has learned to travel to meet the people where they are.
I've gone round with the board members today. I'd like to recognize the chair and the rest of the board members and the executive secretary for working so hard and assiduously to see that this formal sector incorporation into Boschma is fully done. They have, prior to coming here, visited other states, which include Yobe, Gombe, and Katsina states, where they've seen for themselves how these states have done with integration of the formal sector. What I have seen today is excellent. I like to appreciate them for the hard work and that they have made a lot of changes into the 5 hospitals we visited today, as well as the Borno State Drugs and Medical Consumables Agency. These changes included infrastructural changes where adjustments have been made to facilities so that formal sector can be accommodated. Seating arrangements have been done, and in many of these hospitals it is actually better than private hospitals outside. So we are very grateful His Excellency has brought the formal sector on board, and we're very grateful to the Boschma for ensuring that this is possible. I'm sure you're well aware that the contributory agency is very crucial in terms of care and management, because a lot of Nigerians spend a lot of money out of pocket expenses in order to get health whilst they are sick or not well, and this in some figures is up to 70% will do so. But with this, we can assure you the formal sector in Borno State will now have a sigh of relief. They've all been captured on computers with their families, and they can now come to these facilities and be seen to with professionals on ground and with all the equipments necessary to initially assess them. This includes laboratory services. We have seen how in these individual hospitals, their pharmacy departments are functioning very well. They have been upgraded, and you have seen even branding of the drugs that is being supplied by Boschman. This is really, we have taken it even to a greater height. We have also visited the Drugs and Medical Consumables Agency. I want to appreciate the Executive Secretary and his staff and the board members there, where they have been able to cater for this formal sector. We have seen the huge quantum of drugs, qualitative drugs, that have been made available for the formal sector. And this is going to gradually extend not only within the same hospitals, but also within the state.
According to Boschman, the goal is simple: remove obstacles between people and care. Enrollment has been simplified, processes streamlined, outreach expanded. Healthcare is no longer something patients must chase. Instead, services are being designed to pursue the people.
What we have been trying to do is that we want this agency to function, and that is the mandate of His Excellency, and the agency is going to function. And now we have decided to support the various facilities. We supported them with a lot of things. We have been having serious discussions on the manpower supply also, together with the drug agency management. And then very soon we are also going to engage the ambulance services to work together. So, and I'm happy.
What Boschman believes in is actually digitalization, and you can see it during our visits. A whole lot of things has been actually transformed. The electronic health record has been established by the agency, and then we have now transmitted it down to the facility level. We've also supported those facilities with hardwares as well, not only softwares. You can see all the computers are available, the CCTV cameras, and all those things are actually interconnected in such a way that you can even monitor the activities while you are even at home. So that is the beauty of it. As for the enrollment processes, we also did the same. Earlier on, we started with direct biometric capture, and eventually we now developed a link whereby every person can be able to enroll himself by going through the link, and he can also enroll his dependents, his wife or his or her husband, or children, that is the four children below the age of 18. And the electronic health record has helped us a lot, where in the past we've been battling with missing records. We've been battling with missing folders of patients or enrollees at the hospital level, and research cannot also be conducted with this presence of these missing records and what have you. And it is actually through the data that we can find out like how much people have attended, have accessed healthcare, and if there are any issues also, we also have our own dedicated line for customer care. And they can also call those lines to actually tell us if they have any grievances or any suggestion that might actually help us. And through that, we were able to achieve the little that we have achieved. And our electronic health record didn't only stop at the facility level. We also integrated it down to the drug management agency, whereby as the drug management agency is supplying drugs, they also impute those drugs into their system. And the hospital also imputes the same drugs into their system. So as the patient are utilizing the drugs, we can actually identify whether those drugs are actually going down or they are missing, and then what happens to drugs. So if any drugs is being missing, we know the count that we have actually supplied to the hospital. So it's very easy to detect that we have this missing drugs. And this is all the beauty of electronic health record system. So we are actually expanding it, and we are innovating. We are continuously innovating. And one of the innovation is that, as you can hear from the Honorable Commissioner, is that our facilities are going to be integrated in such a way that even if you are a specialist in a different facility, you can also be invited into another facility where that specialist is lacking, so that you can also review some of those cases. So these are some of the things that we have listened. So over this period, I can tell you that that the agency has capitalized the drug management agency by the approval of the board of the agency, worth about almost 170 million naira was actually given to the DMA, so that the DMA would capitalize the formal sector, as well as support that we gave to the facilities stands at almost 50 million. And you can see when we went to the facilities are still need some further support. So this is one of the beauty that we actually added to the health sector. And the other one is actually the coordination that the Honorable Commissioner is leading in the health sector. We are not working alone. With the hospital management board, the primary health care development board, as well as the drug management agency and other stakeholders are all part of this particular system. So we are not working in isolation, and that's why today you have seen us together with our Honorable Commissioner and even the Executive Secretary for the DMA moving together to see like the system works. So, and this is actually what the governance system of the health sector in Borno State, being spearheaded by the Honorable Commissioner, and with the political will that we have from His Excellency the Governor, has made a lot of things possible for us. Without them, we may not be able to achieve this milestone. And we are hopeful that next time, if you come, you will see also another different thing by the grace of God.
No healthcare system can function without medicine, and the tour moves to the Borno ready for distribution to healthcare facilities across the state. Medicines, once scarce, are now standing by, prepared to serve.
Our major responsibility is to provide qualitative and affordable drugs in every ramifications in the state. That is to every facility, both primary, secondary, and tertiary facility. As part of our mandate to be part of this formal sector program today, we are here with the team to show you how we have prepared for the formal sector that's just about to commence now. We are here to show you where we are, the drugs that we have procured under the MOU are signed with the Borno State Contributing Healthcare Management Agency. As you all know, our goal and mandate that we have been established is to make sure that we provide every drug and consumables to every facility in the Borno State. So in line with that, we have procured all the drugs and consumables required to start the formal sector. And we are here to show you how they have been warehoused and then the distribution pattern.
Healthcare in Borno is not merely recovering, it is repositioning itself for resilience and long-term impact. And as the state continues its journey of restoration, access to quality and affordable healthcare remains central to securing a healthier and more stable future for its people. That wraps up this week's edition of Borno Restoration. Thank you for watching. I am Jessie Tafida. Join us next week as we continue to track progress and spotlight transformation across Borno State. Bye-bye.